joining us. Today we're going to be discussing virtual gastric band therapy with Tony, which is a very effective way of losing weight. What is virtual gastric band therapy and how does it work?
Virtual gastric band therapy, the description I guess is hidden in the title. It's virtual, it's not real. And what we're aiming to do is to convince the subconscious mind that you've actually had a surgical procedure. So we put you into a state of deep relaxation and take you through a scenario that suggests that you're actually in hospital and you're going to a ward and you're going to undergo this surgical procedure. You meet the anaesthetist and the surgeon, virtually of course, and then we perform the procedure by convincing your subconscious mind that you've had the operation to install a virtual gastric band. There are variations on gastric band. Sometimes it might be a gastric sleeve or gastric bypass, but basically it's all the same approach where we convince the subconscious mind that you've had something done.
How does a virtual gastric band differ from weight loss surgery or dieting?
Well, the great thing about a virtual gastric band is that there is no risk. Obviously, if you're going to have an actual gastric band or gastric sleeve or whatever, you have to be admitted to hospital, you have to be assessed, you have to be prepared, you have to undergo general anaesthesia, which is not without risk, and of course you have to undergo the surgical intervention itself. And although a lot of these procedures are now done keyhole style, nonetheless you're still at a risk of infection and complication, bleeding. So the virtual gastric band, as I've explained previously, is where we convince the subconscious mind, which doesn't know what's real, it doesn't know what's true, it doesn't know what's false, it simply believes what it's told. And so you are convinced that you've had the operation, and because your subconscious mind is convinced by this story, then your body responds accordingly and you end up losing weight.
And who is virtual gastric band therapy most suitable for?
Well, it's interesting because I wouldn't claim that virtual gastric band hypnosis surgery works for everyone. There's a pretty high percentage it works, but it's designed for those people who want to avoid surgical risk. It's for people who have a good imagination. It's for people who have a real desire to achieve a certain goal, certain weight loss objective. Of course, the other consideration to take into account is that having a virtual gastric band done in real life is a very expensive proposition and may well cost you in excess of $20,000. So a virtual gastric band, I would suggest, is the first port of call. You may save yourself a lot of time and money.
If you're struggling with portion control, emotional eating or repeated dieting cycles, virtual gastric band therapy may be worth exploring. Smart Thinking offers a consultation to assess whether this approach is suitable. Please book a session via the website contact page.
Thanks everyone. Bye.